Roll me 2 minutes from the street, right from the street to. Okay, so in a minute 30, we'll start.
Okay.
Really drink water. Need to hydrate.
Huh? Usually it's like packed in here. There, people sitting there.
Oh wow.
Usually, yeah.
Oh wow.
Yeah, our housemates, one's in Kent and the other one's somewhere else today. So that's why it's a bit empty-ish, but usually.
Oh, I see.
Yeah. Oh.
It's quite a really nice area.
Yeah, it is, isn't it?
Yeah, New Malden.
Yeah.
Yeah.
Yeah, my friend used to live in Kingston, and when she told me, I used to live in Croydon. I was like, Kingston? But it's actually not that far from Croydon. It's about 20 minutes, 20 to 25 minutes. Maybe from 25 Croydon? To 30 minutes driving.
Maybe it's where you live in Croydon.
Oh, my sister lives in Thornton Heath.
Okay,
yeah.
I think that's why, yeah.
Yeah.
Thornton Heath is not too far from Mitcham.
Yeah.
And Mitcham is kind of like in the middle.
Yeah.
Yeah.
That's small. Nana, you better come in or just remain out. Yeah, 20 seconds more.
Nzi.
Perfect.
15 seconds more. 10, 9.
This is the worst part
8,
after this.
7, 6, 5, 4, 3, 2.
Hi everybody and welcome back to We Are House of Medics. It's me, your favourite Tanisha, and joined with me is the beautiful Nzi. So I'll just let her introduce herself. If you want to go ahead.
Hi, I'm Nzi. I am a primary care nurse working in the community. I'm also a mum and I'm an entrepreneur.
Awesome, thank you. So first things first, guys, I don't know what a primary nurse is, and I know that sounds so ridiculous. In my head, and I always do this, in my head, a nurse is somebody that looks after the elderly.
Right.
And when it has the word primary in front of it, maybe you're like a senior person who looks after the elderly. So can you tell us what is a primary? It's a primary care nurse, isn't it?
Yeah.
Not just a primary nurse.
Yeah, primary care nurse.
Okay.
Yeah,
so yeah, tell us what that is.
So primary care nurse is someone who cares for someone firsthand. So before they go into the hospital, we care for them first. So primary as in first, and then secondary second. So if we're not able to meet their needs, then they go into hospitals. Right. So GP surgeries, district nursing, first line support, like people who come to people's homes and take care for them in their homes, would also be considered primary care. And then if they go into hospitals, then it's secondary care, and intensive care is like tertiary care. I can't even pronounce it properly, but yeah, that's considered tertiary. I hope I'm pronouncing it right.
I wouldn't know. So I am the wrong person to ask.
The third line of care, basically. Yeah. So and I'm specifically a home care nurse.
Right. So where do doctors come in to that?
Doctors
primary, second, and third. Yeah. They're in all.
Yeah, they're in all. So you can find all healthcare professionals, from support workers to doctors, in all of those sectors.
Right.
Yeah.
Okay, so how did you get into becoming a primary care nurse? And how comes it's not just like primary nurse? Why is it primary care nurse? What's the difference?
That is something that I actually don't know why. I don't know why they call it primary care nurse. But I got into primary care. It's always something that I've wanted to go into.
Really?
Yeah, I didn't really see myself in the hospitals. I wanted to be a GP nurse. I was I'm going into nursing, I'm going to be a GP nurse. And I think because I'm a mum, the working hours in a GP surgery just kind of fit my lifestyle, as opposed to like working in the hospitals. You don't really get to pick the hours that you work. You kind of get given a set rota, and then if you can't work those hours, you ask for time off.
Okay.
Yeah, whereas primary care, you can negotiate your working hours based on your life.
Right.
So I kind of went in there and I thought, yeah, I'd love it because
suits my lifestyle.
It suits my lifestyle. But then being the type of person that I am, I like to challenge myself, and I like to always aim high. Like I don't like settling. I feel so uncomfortable when I settle. Yeah. So when I did get into it, although I loved it, I just felt like I wasn't challenging myself enough. Yeah. So I wanted to get something that was still in that primary care setting, but a bit more challenging. And that's how I ended up in a home care type of setting. So from GP surgery to home care.
Okay, got you. So I'm just going to dig a little bit deeper.
Okay.
And guys, please make sure you click the thumbs up button. So don't send the thumbs up. Click the thumbs up button and like the video that you're watching right now, the live that you're watching right now. So you said that you always knew you wanted to be into like primary care. How did you know? When did you know? Did you know growing up that you always wanted to look after people?
Yeah, so that is a little bit challenging because when I started my professional life, I started as a lawyer because my dad basically bribed me and cried and blackmailed me into going to study law.
Right.
So I did law, but I wasn't feeling fulfilled in it, and I'm someone that like I would help anyone no matter what they've done.
Yeah.
And so someone kind of suggested nursing, and I did NHS 111 for a while. So I thought, well, let me go and see what it's about. And if I like it, then I like it. If I don't, I can always go back to law.
Yeah.
And I loved it. I haven't even looked back or thought about going back into law since then. So yeah, that's kind of how I got into the healthcare. I got pushed into it and I thought,
and you liked it.
I loved it. Yeah,
that's really good. So your background is actually law, so you can do a bit of both. That's really cool. Okay, so tell us a bit about your studies and how you found that. I know what I've learned from interviewing people is that a lot of people actually study for about 3 to 4 years first. Is that correct? And then they study medicine and then they go into doctors. Hospitals, right?
Yeah.
Is that what you had to do as well?
So mine was a little bit different because I did the law first. I did a postgraduate diploma, which is like a master's in nursing, and that was 2 years instead of 3 or 4 years. So yeah, normally it's 3 or 4 years. 4 years if you've not done anything in healthcare. So you do like a foundation course to kind of give you the skills to then do the degree, or 3 years if you've already got some kind of experience. So either you've done the social care diploma in college or you've done some kind of health.
So did you do something health related in college?
No, not at all.
What did you
no,
study in college?
I actually worked as a support worker.
Okay.
That's kind of what got me in the door.
Right.
So my experience of working with the NHS 111, and I worked as a mental health support worker.
Okay.
And that kind of was what I said, look, I haven't got any qualifications in nursing or health, but I have all this working experience. And that was enough to get me through the door.
Okay, nice. So did you enjoy your studies?
It was definitely challenging, like having studied law and then studying nursing at
Two very different things.
Very different. I would say law was easier than nursing. I didn't realise how hard postgraduate would be.
Wow.
I think
that's actually shocking to hear.
It is, isn't it? But it's true because you sort of think to yourself, oh, it's nursing. I'll be fine. Like, I've done law, I'll be fine.
Yeah.
But you don't realise that actually it's postgraduate nursing. So the coursework is a lot tougher in terms of what they expect you to get than if you had probably done it as an undergraduate. And then coming from like working to then go back and being a student, and like I'm a mum and I'm a student, it's like, whoa. So I definitely had to get used to being a student again. But yeah, I wouldn't actually change my experience because I think it's shaped me to be the kind of nurse that I am today.
So would you say, were you kind of full-time studying? What were the days like? Was there a lot of group work? Just so people know what to expect if they want to go into that as well.
I was definitely full-time studying. The days, it was very intense because you're basically doing the 3-year course in 2. So you're doing all the placements, all the exams.
So placement, placement is when you go somewhere else to practice what you're learning, correct?
Exactly, yes. So placements is when you go into the hospitals or you go into the community and you just see what the nurses do. So that's where you gain your experience of nursing. So your skills, those clinical skills that you need to qualify as a nurse, you get it from placement. So you need to pass your placements as well as passing your academic work, so your courseworks and assignments and stuff.
Okay. Yeah. And tell us a bit about like a day in the life or a week in the life for your studies. Is it a lot of group work? Is it mostly theory than practical? Yeah, so it's a little bit mixed. So let's say a month. I think that's probably better than a day because a day could literally be anything. So like a month I could have 2 assignments, so 2 courseworks to do, and I could have a placement maybe 3 or 4 days within that week. So each week I'll have to go to placement for either 2, 3 or 4 days that week. And then
Group work, not so much. I think the whole of the 2 years, I probably only had 2 times that I had to do group work. It's mainly independent learning. So you get the assignments and then
Oh God.
yeah, this is what I'm saying is harder than law, because you're thrown in the deep end, and it's like you're at the level where you should be thinking more critically and independent. So yeah, but I think the undergrad isn't so scary, because the undergrad, you get more time. So where we're doing it in 2 years, they're doing it in 3. So they have a longer period.
Okay.
So maybe if
it's
we
more spaced out, then, isn't it?
Yes, that's it. So if we have like a month to do something, undergrads will have like 2 or 3 months to do it. So it's they've got that time.
Okay.
Yeah.
So sorry if I've missed it. Did you do an undergrad as well?
I did my undergrad in law, and then I did my postgrad in nursing.
Okay.
Yeah.
Okay. So you didn't have to, or they didn't ask you to actually do an undergrad because of the experience that you've had with the 111 and all of that stuff. Okay.
Exactly.
Okay. Cool.
Yeah.
So do you have anybody else in your family that actually studies medicine, or do you have any doctors in the family? Because a lot of people I've spoken to, their mums are doctors, or their dads are doctors or owners of GPs. Yeah. Do you have any family background already?
I do. Like from my dad's side, I think like 4 or 5 of them are doctors. Yeah. But because I grew up with my mum's side, I didn't really get to see that side of things.
Oh, okay.
And from my mum's side, they're all nurses. So I've kind of definitely followed in the women of my family. Yeah. So definitely I've got loads of family members that are in the healthcare profession. And my uncle from my dad's side, he's I don't want to say it right, wrong. Like he's a doctor, but like specifically to do with feet.
Podiatrist?
That is it. You're on the ball. I'm
learning.
You're on the ball.
I'm actually grown, guys. Did you see that? I taught Nzi something. Like, I'm so happy.
Exactly.
Podiatrist. I'm actually proud of myself.
Yeah. So that's what he does.
Yeah, go me. Okay, cool. So, what was I going to ask you? I've lost my train of thought now. What was I going to ask you? Yes. So, tell me about a typical day in the life of being a primary care nurse. Okay. So from when you wake up, the cereal you eat, everything. Like, tell me a typical day in the life.
So, as a home care nurse, which is what I do, and it does fall under primary care nursing. I get up, make myself a cup of coffee, and
essential.
Yeah. And just hit the road. So I can have about 3 or 4 patients that I see. And they give us like a tablet, so we...
Is that throughout the day, sorry, or for the morning?
Throughout the day.
Okay.
Throughout the day, yes. Sometimes it can just be for the morning, but just on a typical day, it's kind of split. So you might have 2 patients in the morning, and then maybe 1 or 2 in the afternoon. Cup of coffee, get in the car, check where I'm going, and what I normally do is set my routes on my navigation so that I've got everything prepared.
How do you know where you're going? How do you know who the first person is? Do you find out the day before, or is it emailed? Or?
Yeah. So basically, we've got a software that they train us on, and they put all the information that we need on that software. So the patient's details, their address. We normally get it a day or 2 days beforehand.
Okay.
Yeah.
So you can plan in advance.
That's it. Yeah. So the night before, we actually have to go into the patient's folders and just check what we're going to do, to see what kind of patient they are, just in case there's something that we need to bring along to the visits, then we do that. So coffee in the car, check the patient that I'm going to, and set the rest of the day, the postcodes of the patients that I've got to see, so that once I'm done, I just need to click on their postcode and go to the next one. Yeah. Okay. That is literally a lifesaver, because I used to sit there, go back again. Yeah. Exactly. And I literally just drive from patient to patient. The type of work that I do is IV therapy. So we provide IV treatment to patients that would otherwise need to go into hospital to get it.
I have a question.
Yeah.
What is IV therapy? I have never heard that before, ever.
Okay.
IV therapy. Okay, let me guess what it is first.
Okay, go ahead.
I think IV therapy is, to me, the first thing that came to my mind is, you know when you get like stung by a jellyfish?
Okay.
You have to put like a special something on it.
Right.
To make you not like die.
Okay.
So that, in my head, it's something to do with that. What is IV therapy?
I mean, you're not far off, because you probably will need IV therapy if you get stung by a jellyfish. But it's basically giving you medication through your veins. because it gets to you faster
into the blood,
into
right?
the bloodstream. That's it. You see, you know a lot more than you think.
I've been learning, honestly.
Exactly. So we basically give them their medication through their veins, but it's mainly dealing with patients that are on parental nutrition, and parental nutrition is just a form of nutrients that they need, that their body needs, because their body can't sort of
break it down.
Yeah, it's not producing what it needs to
Right.
you know, or they can't. They have some form of condition that doesn't allow them to break the nutrients in their
produce that certain thing.
Yeah, so we basically give them that nutrients that they can't break down in their body.
Okay.
Yeah, so give that on to the next patient, do the same thing, and sometimes we give injections. So we have this injection called Stellara that we give, which is amazing.
Stellara.
Yes. It sounds like a lady's name.
Sweet, actually.
Yeah.
Stellara.
Yeah, but it's really good because it's given to people with Crohn's disease, people with eczema and psoriasis. And to see the difference in what it does to them is just amazing. And I think that's what makes me love being a nurse, to see that kind of
people getting
360.
better.
Oh, it's lovely. And so this medication with people with psoriasis, they normally have like very dry skin, but it can sometimes be very painful.
Right.
And this medication just clears it all up.
Yeah.
And it just means that they've got their life back. So
that goes in through the vein as well?
No, that's an injection.
Okay.
Yes,
Okay.
so the Stellara is an injection.
Okay.
The TPN, which is the parental nutrition, is the one through the vein.
Okay,
yeah.
got you.
Yeah, so it's nice to see that something is making such an impact in their lives, so much so that they feel like they've got their life back. Some of the patients that I care for, they literally would dress covered up because it's everywhere.
That's so bad,
but after like a month or so, they're wearing like short sleeve tops, and you can see that their confidence is back.
Yeah.
It's amazing.
Oh, I love that.
So then after I see my patients, I normally strip down. So I normally go to a public toilet or something and just change into a different form of clothes, just so that
every time you see them for every new patient?
No. At the end of the day.
Okay.
Yeah, at the end of the day, I'll strip down, take off my tunic. If I haven't got a top underneath, I'll just pop one on whenever I get to my bag, and take my clothes off and then drive back home.
Okay.
Yeah.
Nice. So what are the typical hours like? Does it vary?
Okay.
Or?
It does vary. It does vary, and I think it depends on specifically what hours you want to work, because I'm doing it full time. I could have days where I'm only doing 2-3 hours because I've only got the one patient or the two patients, and then I've got other days that are like 8 or 10 hours because we're driving. Yeah.
Sometimes is it from one end of London to the totally opposite end of London?
And the thing is, it's the whole of the south, so it's not even just London. Yeah, so I live in Southampton, so I can be driving from Southampton to Guildford, and then back again, and then to Bournemouth, and then back home. So it's literally the whole of the south. But I think once they get more people into the profession, then we wouldn't be driving so much. But yeah.
Okay, so what do you love about your job? I love the fact that you said a patient can take a certain thing and you love seeing them actually recover and make this 360. Yeah. I think that's amazing. Yeah. It shows that you love what you do and that you have compassion as well. So what are the other things that you actually love about your role?
I think for me, with nursing, it's all about the rapport with the patients. Like, I love making those relationships that, they know who you are, and it's not just like I'm their nurse. It's like almost like I'm part of their family almost.
You're going to their house as well.
Yeah, you're going to their house.
Do they offer you a cup of tea and stuff like
Absolutely.
that?
Although we're not meant to take it.
Yeah,
I don't want to get told off.
I mean, I would. Get into winter now, I'm going to need those cups of tea.
Exactly. Like, how can you be expecting me to drive in winter?
Yeah, from Southampton.
So it's like just, having that relationship with them, I think is one of the highlights of my job. That's one of the favourite things.
Okay.
Yeah.
And if I can ask, I'm not sure if you're allowed to answer this, do they give you petrol money? Do they provide your petrol money?
Oh, yeah.
Okay, good. Okay.
I will not be driving.
That's money. Yeah.
It's a really good company actually, because they give you a company car.
Oh, wow.
And they give you like a top up, so they give you an amount of money that you can use monthly for petrol.
Wow.
And the company car, you can pretty much use it for like personal use
Yeah.
as well. So I'm like, I mean, that's not too bad.
It's not bad at all.
That's
So you're
not bad
getting your
at all.
salary,
Yeah.
your money for petrol, the
Yeah.
company. You might have to tell us the company after, not online, but after.
Yeah.
Okay, cool. So let's go a bit deeper into the pros and cons. Again, for
Okay.
people who might actually want to go into healthcare.
Okay.
Aaliyah, I've seen your question, so I'm going to answer it. Thank you. And if anyone else has any questions, please make sure you send them through as well. But yeah, if you can tell us more about the pros and cons about the work.
Okay.
The role even, sorry.
Yeah, so I would say the pros, like what I mentioned, relationship with the patients. Also, like if I have just the one patient, then I'm getting home for 12 and I can pick up my son from school. So it just means that the hours are not so rigid.
Yeah.
The team that I'm with are so supportive. Like if something comes up and I, need to take a day off for something, I just need to speak to my manager and it's done. So it's not like in the hospital where it's like, you're scheduled to work that day, it's done. So they're very, very supportive, especially during COVID. I've heard nurses say that during COVID they were always there making sure everything was okay. Some of the cons are probably the driving. I'm a baby driver, so I've only been driving like 2 years. So driving up and down has not been easy. So I definitely would say you need to love driving if you're going to do this job.
Role, yeah.
But you get used to it after a while. Like in the beginning I was like, nope, I'm quitting, I'm going.
Train, but can you get trained in this role, or is it strictly okay?
Yeah, you definitely, as in driving.
Yeah, like instead of driving, would you ever get the?
Oh no,
the train?
this is the thing. No, you can't actually, because you have to go from patient to patient, and so your patient might be at one end of England.
Okay,
and you need to be there for a certain time.
Got you.
So waiting for the train and stuff like that, you might not make
long,
it.
yeah, got you.
Yeah, so that's why you can't get the train. So you definitely need a license to do it. But let's say you had a few points on your license or something like that. They'll still hire you. It doesn't like stop them from hiring you. And actually, if you're a newly qualified driver?
Yeah,
because I was like, I know you can say that in nursing, but I didn't know about the driving part.
Yeah, newly
but
qualified.
yeah, so if you're a new driver, like you can still apply for the job, because I know some places it's like a year, but yeah, you can still apply. I'd say another con is like maybe the late nights when you finish really, really late.
What's the latest you finished?
Probably 11.
Oh wow.
Yeah, but that's only because my last patient was at 9 and she lived in Guildford. So Guildford back to Southampton is like an hour and a half drive. So yeah,
that is long.
yeah, but those are like pros and cons.
Yeah. Okay. Cool.
So it's not that bad.
Yeah. No, it doesn't sound that bad. And the petrol thing, it's a win-win for me.
It's a win.
Okay. I want to talk about working as a team and the importance a team is in this role, if it is, because I'm guessing that you drive there by yourself, but you mentioned that your manager kind of helps you when you have your days off. How important is it to work in a team in that kind of environment, and how often do you actually get to see your team as well?
Yeah, I mean, because I do lone working and like you said, working by myself, I don't really get to see a team unless I'm doing some kind of training. So if I'm doing a training day, like we had a cannulation training day and I got to meet other nurses. Yes.
Okay.
Yes.
Okay.
Yes.
Yeah.
You need the cannula in order to get in the veins. So yes, if I'm doing a training day, then I get to meet other nurses that I work with. But actually, when I was training to do this role, I met the other nurses that were in the south.
Okay.
And what we did was we created a WhatsApp group in case anything changes or in case, we're feeling a bit lonely, being out.
Each other
And so, like you've got a team, even though you're working alone. And it's very important to have that, because working alone, you do get to feel a bit scared, especially if you make mistakes and there's no one there.
Yeah, you're going into a random person's house, so I get it.
Absolutely. So it's nice to have that team there. And like I said, my managers, they're very supportive. There was a time where I had to go into Liverpool to do a training again. And I got to meet the people up in Liverpool. And it was really good, because even though I'd never met them and they're a different part of the company to where I am, they were so friendly. It was like I'd known them my whole life. So it was really, really nice, the support that they give.
Okay, awesome. So we're gonna go into a couple of questions. I've got one online. I've been sent 3 as well.
Okay.
So we'll go into these ones first. How has COVID affected your usual routine at work?
Okay. So when I worked through COVID, I was actually working in a GP surgery.
Oh, wow.
So can I speak about it in regards to that?
Yeah, anything.
Okay, because
at all.
with this job, it hasn't really made much of a difference because they've been working throughout the pandemic. So.
Okay. I'm guessing maybe the difference is that you have to wear a mask now and washing of the hands constantly.
Absolutely, yeah. And when I was in the GP surgery, we definitely had to wear like the gowns, the protective gowns. Yeah.
PPE?
The PPE, yes. Yeah, so the gloves, the gowns, the mask, and the visors actually, which we don't have to wear now.
Yeah.
And I remember like when I first started, you just wear your uniform and that's it. You don't even need to wear gloves to give injections. Even though that was like a big debate with people, you don't really need to give injections because it doesn't really do anything. But yeah, I'm not going to cause a debate. So yeah, that was the difference between before COVID and then during COVID, all the mask wearing, and you could only see the patients for a certain amount of time.
Okay,
and
how long, if you don't mind me asking?
I think it depends what it was. So I did a lot of baby immunizations, and that would normally be, I think, about 5 to 10 minutes.
Okay.
But it was 15, given the fact that it could take longer. You know, you've got all these things you need to prepare.
15 minutes?
Yeah.
So you literally had to be in and out, basically?
Yeah.
Right.
Yeah, so the patient has to be in your room. You have to do the procedure, and then they leave within 15 minutes.
Wow. Okay.
Yeah. It was 7 minutes before.
Yeah.
So 15 minutes is a lot better, especially because I was...
7 minutes?
Yeah. I think with the doctors is even like 5. So yeah.
Okay.
So that was one of the things that I actually appreciated, and actually the support again that the surgery gave you in terms of just making sure that you're okay. You know, if there was anything that you were worried about, having someone just sit with you and talk to you, because you know, you're somewhere where people are coming into your space. You don't know what they're bringing in, and you know, you have to go back to your family as well.
100%.
And I remember there's times when I couldn't even hug my son because he wanted to come in, but even though I was stripped down, it's like, no, I don't want to give you anything because of what I do for work.
Right.
So definitely those was some of the things that I was really, really like concerned about. But now I guess because the cases, and I mean, I don't know what's happening with the cases, but because there's measures in place now, it's not as bad as what it was when it first started. Yeah.
Okay. Can I ask if your work has ever affected your mental health? Have you ever had really, really bad burnout? You're like, you know what, I need a week.
Absolutely. I think whatever the work you do, when you, especially nursing, because of the lack of nurses at the minute, there's a big demand for nurses because, you know, there's not enough. A lot of nurses are doing overtime, like we were speaking before, and I said, I'm being called in to do overtime. And that's why I'm basically traveling back and forth, because there's not enough nurses within the south. And so the nurses that are there are having to pick the workload of nurses that would have previously been there, or the lack of nurses that there is. So definitely I would say that my mental health had been affected because I couldn't see my son as much as I wanted to. And then you work so hard that you then sit down and think, well, what am I working for? I'm looking after someone else while someone else is looking after my child. So you start to feel a bit, you know, like disassociated from everything, you know. And so for me personally, how I get over that is my faith. You know, I have a church group. I have my pastor who's like my spiritual father. So having that keeps me grounded, so that when I do have those times, even though I don't have, you know, a therapist or whatever, I have someone that I can talk to and say, Dad, look, I'm feeling some way. And he just, because he knows me as well, he kind of just talks to me and say, look, okay, you're doing this for a purpose, you're doing this for a reason, but don't let it take over you, or don't let it overcome you. That. Do you see what I mean? So that definitely helps me in remaining stable and just checking myself and asking myself of the whys. Like, why are you doing this? Yes. So that's my way of, you know, combating or dealing with those mental issues when they do come. But definitely, I'd say you definitely need to prepare for nursing, because it's not one of those jobs that you can kind of say, oh, hold on, I'll take 5 days off and then I'll come back when I want to. It's not, especially if you're working in the hospitals. You have to come in on those days. But as well, it's equally important to take days off and take days for yourself and just look after yourself, because if you don't look after yourself, then how are you going to look after other people?
Yeah, exactly.
Yeah.
Lovely, thank you. So the next question is, what would you say has been a really challenging situation you found yourself in as a care worker, and how did you deal with it?
Okay. I'm trying to think of things that are not going to like get me in trouble with certain people. But I'd say like there's a lot of challenging things. One of the things is probably if you're in a setting where you've never dealt with something before, knowing what to do. So a lot of the times they'll send me somewhere where they've not given me the beforehand, like the preparation for that patient, and I now have to give medication to someone that I don't know what their background is. I don't know what their allergies are and stuff like that. So knowing the person that I'm dealing with before I actually go in is something that I find important. So how I went about that is just calling my manager and saying, look, I haven't been briefed for this patient. I'm either not going to give this medication because I don't know how it's going to affect that patient, or if you send me over their paperwork, then I can sit down, look over their paperwork, even though it's going to take me longer because I'm briefing for this patient in this when I'm meant to be giving them the medication. So either tell me what's going on with this patient so I know I've got consent to do what I'm doing, or I'm not going to do it. And I think it's so important to understand your limit and what you're able to do as a nurse.
And that's protecting yourself and the patient as
exactly.
well, isn't it?
Yeah, absolutely. Because if you don't know what you're doing, don't feel pressured into it. And I think a lot of the times we feel pressured because the demand is so much. We feel pressured into doing things that maybe we're not supposed to do. And one of my thing is, if I know I can't do it, I won't do it. Because I don't want to lose my pin, and I don't want to lose this thing that I love so much just because I want to please someone. Do you see what I mean? So definitely knowing your limits as a nurse and just doing what you are capable of doing and not beyond that.
Love that. Thank you. The next question was from Mary. That says, advice to those thinking of doing the 2-year course.
Okay. Right. So find yourself friends that are very smart. So pick out the ones that are like always doing all-nighters in the classroom. So find people that that work really well and very organized, because I'm someone like, I've got all the answers, but I'm very disorganized when it comes to revision.
Right. Okay.
So I made sure
you need a buddy to be like, hey, where are you? We're in the library.
To like balance you out.
That was me as well. Yeah, trust me, I get you.
So it's not like I'm smart. I'm not organized. So I needed someone who knew like how to put it all the way it was meant to. Also read a lot. Go to your lecturers, ask them about the books before you actually go to the lectures, or before you actually start the course. Read, find out how to structure your essays at a level 6, level 7, because when you're doing it as a postgrad, when you're doing it as an undergraduate, it's level 4 to 6 or level 4 to 5. So as a postgrad, it's level 6 to 7. And so the way they expect you to write is a lot higher. And that was one of my issues, is that I was still writing in the way that I would with my undergrad.
Got you.
So I had to quickly learn that, no, they want you to be more critical in your writing. They want you to analyze. So it's not that they want you to describe and say, okay, this is the answer. But they want you to give other things that could possibly be the answer as well. So if, let's say, this mug is blue. This mug is blue, but there also is white on there. So they want you to say
a lot more. Got you.
So they want you to be a bit more challenging in your way of writing. So this is why I said you need the smarter people, because if you know that writing isn't your strong point, then pick out the ones that okay, this guy got an 18. I need to be friends with him. Do you see what I mean?
That's exactly what I did as well. So do what you gotta do. Okay, lovely.
So
so Elia said, how did you find balancing everything whilst being a mum? Did you get any extra support? Or
it was definitely not an easy thing, and the university do give you support in terms of like if you need to talk to someone, but as a mum there's no specific support that is like childcare support or anything like that. So I say definitely if you're a mum and you want to go to uni, plan like childcare before you go. So try and sit down and think about whether you can actually manage to do. The academic stuff isn't the problem. The problem is the placements, because the hours that they want you to do for the placements, you can't work around it, because you have to do a set amount of hours in order to pass. So you can't sort of negotiate your hours to do maybe 10 hours a week if you need 40 hours a week to pass. Do you see what I mean?
Yeah.
So definitely sit down and try and see how you can manage those kind of things. And the university can definitely support you in terms of giving you more time.
Okay.
So, for example, if you needed more time to pass your placements because you were not able to, then they'll give you until the end of your course. So let's say your placement ended in November, but your course ends in January. You basically have until January to make up all the hours.
Oh, wow.
Yeah. Which
that's quite good, actually.
I don't know if many people know, but yeah, they give you until the end of your course. Once you've made up all those hours, then you basically qualify at the same time as everyone else.
Yeah. Okay, that's quite good. Okay, and another question. It says, do you have any terrible experiences from going into somebody's house?
Like negative experience?
Yeah.
I wouldn't say so.
Surprising or shocking happen from any
I would say
visits?
probably like the messier houses. Like are probably
shocking,
a bit
like,
challenging.
whoa.
Yeah, because the company I work for, the patients that I normally deal with, they're very like high class, middle class, you know. So then to go to a house that's like, you know, a bit different, you're like, oh, it takes you back a little bit, and then you're like, okay, well, I need to find the bit where it's safe for me to do this or to give this medicine, because we have to be sterile in where we're giving.
Right. Okay.
So I can't give the medication somewhere that isn't
not clean.
Yes. Yeah. Okay. Because then it could cause you to have an infection. Yeah. And then because I'm the last nurse, the blame is going to be on me, and I don't want to be blamed for nothing. Yeah. So definitely, I try not to judge, and I just kind of scan the room for where is the cleanest and where can I go to give this medication. Usually the bedrooms are okay, but then you don't want to go into someone's bedroom.
Do you have to ask them, oh, is it okay if we do it upstairs? Or do you say, can I have a scan of the house? Like, what do you...
They normally have, like, the rooms that they normally do it in.
Okay.
So some of them, they do it in the bedroom. Some of them, they do it in, like, this... They have, like, a sitting room, like these little rooms.
Got you.
And then, because the nutritional bags, they come in like these sachets. We put it in like a rucksack so that they can move around with it. So it doesn't really matter where we do it, so long as where we're setting up is clean. So after we've set them up, they can now go wherever they want, because the medication itself is in a rucksack type of thing, or a backpack almost. Okay. And then they can just move around and do what they need to do.
You, like, when you speak, you seem like you love what you do, which I love. So I've learned. It's been amazing.
Oh, good.
So we're gonna begin to round up. Okay. So again, I'm sure we have a lot of students on. We actually went to Freshers Fair last week and the week before.
Oh, nice.
It was amazing. So I hope there's some students watching us. You guys, we forced you to subscribe. So hi, and thank you so much for subscribing, and welcome to the first House of Medics stream. So just for the students that are watching, what would you advise any that do actually want to get into becoming a primary care nurse?
Okay, I'd say don't be thrown off by what people may say when you're studying, because a lot of people say, like, don't go into the community, go into the hospitals first, and once you've got the experience then you can go into the community. But don't be thrown off by that. Just follow your heart. And
sorry, just to confirm, when you say going into the community, do you mean near where you work? Like,
no, so primary care, primary care is also considered community nursing or community work. So it's working within the generic term of community. Yeah, so like outside the hospital, let's say. Yeah, so working outside the hospital is another word that people use community for. Even primary care is community. So I understand the confusion, because I was confused for a long time, and I'm a nurse. So yeah, definitely don't be thrown off by that. Go straight into it. There's positions where like even where I work, even though it's quite highly skilled, they still take on newly qualified nurses, and they will train you. They will give you the training. And although I had experience when I went into being a general practice nurse, I'd never worked as a general practice nurse before. And so I was hearing, no, they won't hire you because you don't have at least 1 year experience and this and that.
So people said that to you?
Yeah.
Right, okay.
But I just went for it. I just didn't listen and I just went for it. And they hired me. They didn't even give me an interview. We literally just had an informal chat and they gave me the job.
Oh, wow.
So that just goes to show sometimes you just have to go for something because if it's yours, then it's yours.
It's yours, yeah. Love that. Awesome. So thank you so much. I've learned a lot. I have.
Good.
And you love your role. And I love
do.
that. No, I love that. I love that. I can actually hear and see the passion when you speak.
Good.
So thank you so much for coming on.
Yeah.
So for anybody who doesn't know, and again, for the students who did actually subscribe and that we met at the Freshers Fair last week and the week before, and in case you didn't know as well, we actually have a House of Medics ball that is happening on the 27th of November. So it's going to be next month. It's going to be in central London. It's only going to be strictly medical, people in the medical film.
Okay.
Well, I'm not in the medical film, but I'm going to be there. So we do hope you can join us. It's going to be like a dress up kind of thing. Dressing heels. You can bring somebody, Prosecco on entry, and it's going to be absolutely amazing. So thank you guys so much for joining us. I'll let you give them your social media handles if they can follow you, and if you are open to like mentorship or anything like that. Absolutely. Can they follow you and DM you? Or?
Yeah, absolutely. I'm always helping out students, so you can slide in my DMs for mentorship. I'm okay with that. And my handle is at @nurse_Nzi.
And the spelling is Nzi.
Yes.
Yeah.
Oh gosh, I should have done that. At Nurse Nzi. That's it.
Awesome,
yeah.
Thank you. Okay, guys. So thank you so much for joining us. So on our website and our Facebook and our Instagram is We Are House of Medics, and our LinkedIn and our Twitter is House of Medics, and the website is houseofmedics.org, not .co.uk. So thank you guys for joining us. We hope to see you at the House of Medics ball next month, and we'll see you in 2 weeks.